Hello, everyone. Today we have with us Dr. Sachin Jhawar. Sachin Jhawar is a distinguished healthcare professional with a proven track record in driving innovation and operational excellence. With extensive experience in the intersection of healthcare and technology, Sachin sir has consistently demonstrated his ability to lead transformative initiatives and to enhance patient care and streamline healthcare operations. Currently, a key player in ZS, a global professional services firm, Sachin Sir excels in harnessing the power of AI and revolutionize healthcare delivery. His expertise spans strategic planning, digital health solutions, and advanced analytics, making him a thought leader in the industry. Overall, we can easily say that he is a visionary leader in healthcare innovation. Hello, sir. How are you?
Hi, Aditya. Thank you for the kind words, and let's try to live up to the hype that you're trying to create by this discussion. But I'm sure it will be good. Yes.
Yeah. So, sir, like for the audience, like my first question is going to be like in order to educate, like to principle them in how AI is impacting the healthcare sector. Like, if we talk about like, can you provide a brief overview of how AI can be utilized in healthcare to enhance patient experience and improve efficiency?
So, Aditya, I would like you to imagine 2030. Let us move forward 6 years. And
Mhm.
unfortunately, there is a friend of yours who lived across the flat to you or across the house to you, and you took him to the emergency of a nearby hospital. You know that your friend is unconscious. We don't know what exactly has happened, and that emergency is a AI-enabled machine tool learning modern emergency. As soon as you get the your friend to the hospital, he's connected to the monitors, and there is a camera that is looking at him. So you imagine uh, whatever the doctor is doing to him, examining whatever the data that the his vital parameters are giving, all of this is going at the back end of a tool, machine, computer, processor, whatever. And immediately the doctor is getting some sort of, so he's a 32-year-old male. You say that he had food at 9:30. He is a non-diabetic, but he has a family history of cardiac problems. He does not take any medications. He exercises every day, this, that, whatever. His weight is being taken, and that has been put. So automatically, the machine, the data, the AI will help the doctor, the staff, the healthcare, the nurses to reach to a conclusion, what sort of investigations should be done, what treatment can they start. And this is, see, in healthcare, AI will it can never be. We have to define AI as assisted intelligence rather than artificial intelligence when we are working, because in healthcare, in literal terms, nothing artificial will work, but you can assist the intelligence, because it is a very, very widely changing world, and time is of real essence. So if I'm at 2 o'clock in the night, and if there is somebody who can tell me that, fine, yeah, you should do an ECG for him because there's a cardiac history. A young patient may not have usually a cardiac problem, but something 2 o'clock happening to a person, you should always think about cardiac problems, or do some test, some ABG, do an ammonia, because of some history that he has had, or something that he has eaten. So all lot of this assisted intelligence or artificial or machine learning or whatever you can call it, some sort of something will help a lot first in emergency in diagnosing the problems early. That is what. So that is the reason why I said that, imagine it is 2030. 3.0, and we are not very far away from them. We are reaching where the monitors will have TOT kind of things, and there'll be equipment that will be cameras which will be able to read the patient expression and everything. We've come across a few situations like that where face reading and other things can are helping, but they are in the process. I'm sure in 5 6 years all of these things will happen. Aditya.
Mhm. Very well said, sir. Like the points that you mentioned about like the machine would be able to easily identify the patient history and like family history as well, whereas the regular routine as well, the kind of meal he's having and everything, like it will create an environment which is around the patient centric care part more.
Yeah,
Like doctors would be able to easily understand the situation of the patients as well, and would be able to provide it or tailor a proper diagnosis or a treatment plan for them as well.
yeah, yeah. So there is one thing that Aditya I want to add here is like, like a shopping center. I have seen
Mhm.
videos of marts in Europe or in US where there is no machine, no man. You are picking up your things, and your everything is being done by the machine. They are not mind. There is no human interaction, at least as far as I can see the future, which is very limited. I do not see human intervention being taken away in medicine for the future. So that is the reason why I say that people who are working on AI should sort of come one step down, and rather than thinking that they will replace the doctors and nurses immediately. They may one day, it can happen and it will be revolutionary, but they have to think of their role as how we can assist, how we can make the process efficient, rather than aiming for that we will exclude the nurse or the doctor completely, and I will take care of the treatment. That is not going to happen, because there are several things which which perhaps at present you need a human to sort of intervene in between, rather than just an AI.
Definitely, sir. Like AIs can, I also believe that AI cannot replace the empathy part that the doctors and nurses have for the patients,
Completely.
and they would be able to understand the mindset as well more better way in terms of like non-verbal cues and everything. So definitely, sir. Like they are not replaceable, but you said that like it is more instead of artificial intelligence, it is more like assistance intelligence that we should be focusing right now on. So we should.
Yes.
I also believe that AI right now can be a good, great tool, a revolutionizing tool in terms of assistance part, and we over here as well are trying to use it in that way only, like in order to provide assistance through doctors and businesses. Coming to the next question, like how can AI be used to improve patient diagnosis and treatment plan? Like we were talking about, like the AI is working on like in terms of like providing assistance and providing understanding the whole history of the patient and everything. So like how it works, like if we go into the detail in
Yeah.
this area.
So basically, see, now what happens is that uh, imagine there are about 300 patients who are coming to a hospital in one day, a normal hospital, and yeah, the X-rays of the patients are being done. It's a very routine thing, and there are now AI or machine learning tools that are reporting these X-rays, um, because it's a film, and as face recognition, the X-ray recognition system is being there. The same is being used for CT scans and MRIs. Of course, there is a doctor that needs to sign those reports, but these are happening. These are there. Uh, in some area, and I'm talking about India. So we know of people who are doing it. They are in the early part, but there are still commercially available tools to report X-ray. We know there are very few radiologists in the country. So, if there is a preliminary report that comes via AI, then the doctor just has to look at the things and sign. So you imagine the efficiency of that doctor. You can maybe 5x or 10x the efficiency of that one doctor, and that one doctor can sort of, report so many things. The same can be done for pathology. Like in pathology, there are slides. If you put in the slides, the photographs are being taken up there, and that can be done. The same is being done for mammography and for uh, you know uh, 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 colposcopy. So breast and the cancer of the cervix are one of the biggest killers, not only in India but in the world. So what is happening are there are handheld devices and the pictures are being taken with AI. The suspect patients are being screened out of it, and then those patients are being called for a sort of a second level examination, which is a mammography and which is a colposcopy. So all these things are being done in the present era, and that is how uh, uh, in a few years time you will find them in huge commercial or patient use. But yes, things like this are being done by Indian companies or by themselves and in association with other people.
Yes, sir. Like as you said, like we will be 5x, or like we'll be increasing the efficiency of the doctor's part as well. Like it would be more better. Like we would be like the same doctor would be able to provide care to and more number of patients in the same amount of time that he was investing earlier. Like if we provide the right tools to the doctor in terms of working part, like how they can use the AI tools to increase the efficiency of the work that they are doing right now. Like that would be
Absolutely,
really great.
absolutely.
Yeah. So, sir, the next question comes, sir, like patient experience is also very important part during like we are using these kind of diagnostic tools and working this part. So, like, how do you think, like, in what ways can AI improve the patient experience in healthcare facilities?
But see, the thing is that if there is a patient, now you can profile the patient, and there are so if there is a 60-year-old diabetic who's coming from a city urban dweller, and in the family he has, these are the number of people that are there in the family, and this is the age bracket, this is the salary bracket, or whatever it is. The expectation of that patient from the hospital or caregiver can be different depending upon what his veget diet or whatever dietary habits and other things are. There are a lot of things that can be tailored for that person in that way. If there is a patient who's going home, and this is again is being done for patient engagement. So if the patient is being engaged and you say that every morning your exercise is planned at 7 o'clock, and that patient is reminded, and you have to take these medications, and you have to avoid this, and you have to drink so much water, and there is an alarm. If so, there are now post operatively, when patient or post hospitalization patients go, there are tools that can be, or there are patches that can be put on patients, and you can monitor the patient's pulse and blood pressure and saturation, everything the doctor can monitor. If that can be sort of put into an AI thing, so as soon as the you will know when the patient moves, because the pulse rate will become more. You will know when the patient is not feeling well, because again, you will know when the patient is sleeping, when the patient is waking up, all of that. And if it can be attached with how much water he's having, how much calories he is having, how many medicines he is taking, imagine the compliance that will increase, and imagine the decrease in the readmissions that you can do. Because Aditya, readmission, 25% of the people who get readmitted for the same problem, there is a very high chance of mortality. There is a very high chance of these patients dying. So, readmission is a very, very dangerous thing. So, if we can prevent readmission in those patients by proper compliance, then there are a lot of lives that can be saved by the use of technology.
Definitely, sir. Like if like as you said, like if the compliance is a major issue, like
Aditya, can I say
people,
something? Aditya,
yeah,
your voice, I see some cracking in your voice. If you can just check. I don't know. Is it just me or is it
uh,
something else? Just check. Just check.
is it better now, sir? Like
I don't know.
is it
You have
still
to. You
cracking?
will have to. It's still cracking. To me, it appears it's cracking. Okay,
One second.
fine. Carry on.
Yeah, so like as you said, like compliance is a major issue. Like like and the fatality rate is very high. Like there are a lot of diseases like spe- specifically if I talk about then one second there is a technical issue.
Hello. Hello.
Yes, sir. So
Hello.
is it
Yes.
fine now?
Yes. Yes. It is better.
Yeah.
Sorry.
Yeah,
Hmm.
that's great, sir. Yeah, so like as you said that the fatality rate is very high in term like if like if you talk about diseases like diabetes, like people who are diabetic,
Hmm.
they they have an inner like urge to eat sweet things, like even though they know that this is not going to be right for them, like and e- like even if the family monitors them, even if a doctor monitors them, they do it when they are not like when no one is monitoring them. The people who are not aware of this that they should not be having the sweet things, like but if the patches and all these kind of things are there, then they would be consistently monitored, and the doctors will know from the data as well that they were not following the prescribed routine that they were told about. So that and the constant fear in their mind would also reduce the chances of them breaking the rules that they and following them in a way that they should be following, I believe.
So very well said, Aditya. So Aditya, what happens is that imagine diabetes. So what diabetes does is basically it affects the end arteries of your body, whether it is our eyes, whether it is our kidneys, whether it is our heart, whether it is our limbs and everything. So there is a subtle change that is happening in our eyesight, in our kidneys, in our feet, in our sensation, in our heart and everything. And so there is nothing like, which is happening inside which uh, people cannot see. So if you constantly image the eyesight or the retina of these people, if you're simply checking the urine of these people, blood of these people, the activity that these people can do, it is very, very easy to imagine the damage that these diabetes is doing. And it is very, very simple that if there is a band that monitors activity and that is related to if you can manage their or sugar by some skin detection or something in their sweat or something. If there are tools which can look at their eyes, maybe some tool which can look at their retina or something at home which can examine weekly their urine that they are passing when they are walking. If there is a slipper or something that is driven by AI or everything, they can have their monthly score, that how they did, how much did they walk, what is their eyesight doing, what is their everything doing. So these diseases like obesity, diseases like hypertension, diseases like diabetes, all of this is probably killing more people than trauma, than cancer, all of that. So there are the possibilities with all these learnings, with assisted intelligence, with all of this is immense. The only thing is that people have to put it to use, and it has to be, in a way, it has to be uh, mm, there has to be economic prudence in their use. And then people have to work as a team, the doctors, the companies, the patients, the volunteers, everybody has to come together to ensure that the outcome is, no one person can probably, say that we are doing this because nobody wants to feel left out, or everybody wants to contribute on a cause where they would be appreciated. So that is something which is very important, and I think India is the forefront of this. We have a lot of people, a lot of data, a lot of digital acceptability. Now, 5G or whatever broadband, whatever you're using, which is very cheap. The whole country is connected. There are a lot of people. There are so many colleges there, and the kids can be given all of these projects. These universities can uh, contact the hospital, and they can work together, because Aditya, I tell you, healthcare has overtaken marketing and sales as one of the biggest employers in the world. Very recently, I think, just post COVID, the healthcare
Yes.
industry is the biggest employer in the world. And if in country like India, if we take this opportunity to ensure that this healthcare net becomes very, very wide, we can assist in, uh, I'm not saying we can change the scenario, but we can really assist in helping the country generate a lot of employment. And the other thing is, see, in our country, if you imagine there is, if you are treating one patient with cancer, you are you have to spend, say, between anywhere between 2 to 20 lakhs. Now, if you imagine, let us say a figure of 10 lakh rupees. In 10 lakh rupees, how many patients can you prevent from developing complications of the cancer? Or I would say, in these 10 lakh rupees, how many early detections can you do? So if the cancer or something is detected early, then it is, you cannot even imagine spending 10 lakh rupees on one advanced cancer, and spending 10 lakh rupees on at least, screening people, saving hundreds of lives. It's not even comparable. And that can all be
Yes.
done by, digital transformation, innovation, and using tools like artificial intelligence.
Well said, sir. Like this, the point that you mentioned just now, like this, like it automatically answers my next question as well. Like how a AI can contribute to reducing healthcare cost while maintaining or improving care quality as well. Like you said that the way the like in terms of identifying the cancer patients and everything, like providing them treatment, all this kind of thing can be significantly improved. Like so yeah, like I don't know like how to recommend like but like you answered the question automatically like
No, no,
things.
just to add on, Aditya. So
Yes sir.
see, what happens is that if you imagine electricity, so about between 30 to 40% of the electricity is wasted while going from the power grid to coming to our houses, and
Mhm.
there is very little that we can do about it, and we are all paying for it. Similarly, in healthcare also, there is about 50% of our efficiency in terms of time, in terms of money and everything, is being wasted because we are very, very generic. If somebody will come, we will have so many tests done. So you imagine the tests that are being done routinely in the laboratory. Most of the people, even if a patient who is on deathbed, if you get all these routine tests done, most of them will be fine. So there is no point in doing all of these tests. Any reasonable A doctor can even tell that, fine, this patient does not need a hemoglobin to be done. This patient does not need a this to be done. Liver function test will be normal only. Now we know the liver function test get deranged if you are either sick or if your liver is 40% bad. Till then, there will be no problem with the liver function test. So the thing is, to minimize this thing, we have to, match the right treatment for the right patient. So if there is a 30-year-old living, say, in Banswara, working as a farmer, muscle mass of this much, the treatment dosage, adjunct treatment, diet, everything, outcome, complications of a cancer will be different to a 60-year-old urban diabetic, uh, limited mobility female, less body mass, less bone mass. The dosage may be different, the complications may be different, the prevention things absolutely has to differ. So one has to see, how we can prevent, how we can not only prevent. See, in healthcare, prevention is a very, very big step. To prevent people from getting cancer, you have to go to the grassroots level and educate. That's the only thing. Or you have to change what we eat and what we breathe and make everybody exercise. That's a behavioral issue. So that is outside the domain of healthcare. Healthcare cannot go. When we are saying prevention in healthcare, it is basically we are talking about early detection of problems, you know,
Yes, sir.
prevention of complication. So I cannot sit here and ensure that this area people don't have diabetes. What I can ensure is biomedical program that people are detected much before the complication of diabetes hits them. So that is where, you it can be preemptive, it can be, it can the intervention can happen much early, or the right intervention can happen. If there is a patient who's coming into the hospital for a treatment, there are 10 complications that are listed, but what are the chances of him getting this one complication, which are much more depending on his demography, depending upon everything? Can I do something about it? That is what I'm talking about: decreasing efficiency, decreasing, sort of, uh, decreasing the wastage that is that has to happen. I have to treat everybody. So there is this something like a pulmonary embolism. So pulmonary embolism is when the patient is in hospital. If he has any operations which is more than 45 minutes, he has to have a triple protection in terms of stockings, in terms of DVT pump, in terms of a low molecular weight heparin. But on the same time, not everybody will benefit or from. But to save that 1 in 1 lakh, you have to do this to 1 lakh people. Can we
Yeah.
define it more closely so that we don't have to do it in 1 lakh people? Because there is harm also happening because of, what we are doing to these people. So can we narrow that spectrum and use the efficiency, use the resources better, especially in a country like India where, everything is limited and we have to use it very judiciously.
Yes, sir. Like resources are always like not like all not nothing is in available in the abundant state. Like resources are
Yeah.
always scarce, and like we have to use them in a right way so that we can utilize, we can be able to provide the kind of service that the person who needs is getting. And as you said, that prevention is the most important part. Like we cannot stop people from getting sick, but we can prevent them from getting into the chronic state. Instead of like
Yeah.
we plan to, we have to end the disease in the acute state only. Like this is the main motive, that which is a very good point. Like you said, like I'm going to remember this for a long time now. And yes, sir, like it is going to reduce the costing as well. Like in terms of, like if the disease is cured in the acute state, then it was like the treatment, the long treatment that would have costed a patient a lot of money, and also the hospital in terms of resources as well, would be prevented and can be utilized in other patients as well, like, which is going to be like, if AI can do this, then it is going to be a very revolutionizing thing as well. Like if it able to analyze the trend and the condition of the patients and everything, then it will be helping. Like as you said, the assistance intelligence is going to be working there.
So I tell you what, that to my advice of for people who are working on healthcare AI. So there are two things, outcome and cost. So I am talking like a, you know, I am talking about Indian ethics in healthcare. These are Indian ethics. I'm not talking about world ethics. To me, AI is useful if it can, in the same cost, provide better outcomes. Okay, in the same cost, better out, or it can, for the same outcome, it can decrease my cost. So AI has to think in terms of outcome and in terms of cost, where one of the things has to decrease and one of the things has to increase. I don't want AI that, you spend this money and this outcome will increase. See, I can spend money on one patient, one patient being seen by two doctors. Why do I need AI then? I don't need AI for that. But what I want is either AI should concentrate on the things that I cannot do despite putting all the resources. Can AI find me treatment of those cancers that at present, unfortunately, I'm not being able to cure? Or am my requirement is 15,000 rupees per bed per patient in the ICU. The hospital spends, or Indian healthcare spends 15,000 rupees. Can AI do it in 10,000? Can it help? The everything. So AI cannot say that fine, you spend 20,000 rupees and I will increase outcome. It will not work in India. I will get another nurse, and then the two nurses will look after one hospital, one patient. I will not pay AI. AI has to either help. See, it has to solve my problem. It does not have to be smart. If unless and until it solves the problems of the hospitals and the patient, AI will not be acceptable. It will just become like a fancy tool. I don't need these gadgets in my car. Why should I pay for it? I don't want to fly. I don't want a fly button in my car. I just want my car to be safe, get me there on time, whatever. I don't want to go gliding in air.
But so like, when we talk about AI part, like there are a lot of ethical issues also available in the market. Like the lot of things that are being discussed as well. Like in terms of the ethical part, like the data is safe or not. The data is it trustable or not in terms of giving our information or not. So what are the main ethical concerns associated with the use of AI in healthcare? Like how can they be addressed? Like if we have to address these issues, how we can like solve them?
Without being too cynical or critical about anything. See, do you remember Snowden? That issue that happened, that uh, or WikiLeaks or something. The controversy when Snowden was a contractor in Pentagon. Pentagon has one of the best security, and there was a data breach even in Pentagon. So see, I tell you what, that we worry too much about this data and ethical breach and everything. I am not saying that is the reason why I used Indian ethical, Indian ethics. So, there is a lot of trust that is there in the Indian ethics. Artificial intelligence as a concept in India should not be loaded with unnecessary worries of data breach and confidential. See, we know, it is in our culture that, we don't have to share each other's data, use this, that, whatever. And I tell you, Indian data is available in loads, in truckloads. wherever you want. So, all of this data, if the companies want to use, they can use it in whichever, whatever way. So let us not worry too much about that part, that who can do good or bad with this data. Let us concentrate on how we can solve the problems. But at the same time, keeping the simple Indian ethical thing, that where the hospitals will let us trust each other rather than building mechanisms and webs and everything and slowing down this AI process. I say that let us trust each other. The hospitals trust the companies, company trust the, and patients trust the hospitals and everything. Let us work together, or doctors trust. Let us work together. Go ahead, and we will worry about whatever data breach, whatever that will happen, will happen. But at present, we have to concentrate on our energies at solving problems and not get into the trouble of data or this or that. Let us just keep them simple. Whatever compliance needs to be done, let us do, and let us move forward. There are 140 crore people to be taken care of, Aditya. We cannot
Yes, sir.
worry.
Yes.
We are not like any other small country. Hundreds of people are dying without your and my intervention every day.
Yes, sir. Like, if the point that you mentioned, the trust part, like if we can trust each other and move accordingly and work in the way to provide better care to the patients as well. Like, if they these kind of thought process come to all the people in the market, like the instead of misusing the data and or providing or moving forward, like if people are given the courage as well, like people are given more awareness aware also in this part that the data is being used for their betterment only, not for getting gathering information only, then I think that these kind of issues can also get reduced very well. Like we would be able to see more data. There might be I personally believe that there might be many other diseases that are yet to come out as well, like the considering the population, the kind of population that we have, and there are areas where the hygiene level is not up to the mark as well. If we are able to get the data, then we might be able to figure out the diseases that we are not yet aware of. This is my personal opinion regarding this one, but like there are a lot of new case studies coming up on a regular basis where we learn about the kind of symptoms that were available in the basic stage, but nobody was paying attention to those part, and those diseases end up becoming cancer in and causing a lot of deaths as well. So
Absolutely fine. Completely agree.
yeah. So sir, like what do you see like in terms of advancements? If you talk about, then what advancements do you foresee in AI technology that could further enhance the patient experience and healthcare efficiency as well?
So we've talked about a lot of things, and
Yes, sir.
AI can help all the machines in learning about the patients. AI can help. So if I'm a cardiologist, I there are 10 things that one has to do one has to get done with the cardiologist. So there are several things that have to be done by a cardiologist. So AI can help the patient finding the right cardiologist who is specialist in, say, putting a stent or putting a pacemaker or treating my hypertension or other things. So not everybody is able to do everything. So choosing the right patient, choosing the right medication. So there are about 25 medications for blood pressure. uh, all, and there are some doctors who prefer a few, some doctors who are a prefer a few. But if I know that in this age with this subset this is the best medication, and it the while I'm writing my prescription, so patient medical records, AI can help me that get this investigation also done. Here is a first time hypertensive, let us get a baseline 2D echo that will help me in the future. All of this because if a doctor is seeing 50 patients, it is not humanly possible uh, to sort of remember the permutation combination of tests, medications, symptoms, preventions, everything. So all of that, if it is integrated, this knowledge that what to eat, when to what to take, what activity to done, what kind of medicines to give, what kind of interaction can happen. this AI and assisted learning can definitely enhance the patient experience. Already, what are the frequently asked questions? So there are some people who are very clever, and they will say frequently asked questions. If I know in this age these will be the frequently asked questions or frequently occurring problems, I can answer or give a printout or send a text message or a WhatsApp or an email to that patient. The patient experience can become excellent.
Mhm. Definitely, sir. Like normally people, even when they go for the treatment part, they first try to confirm their symptoms as well. Like if the FAQs are available, then they would be able to verify the symptoms and the problem that they are facing, and based on that, it will also help them take the decisions, right decisions at that time, and that would also improve, like that we talk about, like solving the issue in the acute stage only. Like prevention is the most important part, so it will be helping in those areas as well. So, sir, my last question for you is that, like, for healthcare professionals and organizations looking to adopt AI, like we were talking about the AI throughout this session. So, like, what practical advice would you offer to them? Like, if they are new to this part, then what is the advice that they should follow? That what they should go for? Like, instead of taking any hasty decision or an uncertain decision that they should not be, that they might regret in the future, then what should be the step that they should follow?
So, Aditya, on a sort of lighter note, there are
Hmm.
three professions which are comparable. Uh, like a trader in the stock market, healthcare professional, and a combat military combat professional in an open air combat. These three people, all of these three have limited time. They have to just act like this. you know they have to make a trading call with, and they all have to do it with very limited information. So if the share is going up, the trader cannot go, let me look at the balance sheet, let me see who the promoters are. He cannot see what the debt is immediately. There are 4,000 companies. He cannot remember. He just has to, it is his subconscious mind, his knowledge, his everything is his. He has to take that call whether to buy or whether to sell, or whether it will keep going down or whether it will go up. The same thing is in a military combat situation. We don't know whether there is an army, that person who is there. The military professional does not know what kind of weapon he has. Does he have a small gun, big gun? If there are 10 people, 20 people, if there is anything else happening. With the limited information, the doctor, the nurses, the healthcare people, whether it's fever, whether it's an infection, whether it is because of drugs or heat stroke, or whether this patient will develop dehydration or renal failure, or how will his heart act because of all of this, we don't know. So these kind of professions where time is limited, the information is limited, resources are limited, some assistance in today's world is very, very important. Otherwise, there is big damage. In military, you lose people. Healthcare, you lose people, and in trading, people lose a large fortune. So, to prevent the losses, uh, some sort of technology innovation is needed. I can only say about healthcare, and it is very high time, and India is set at a very good point where it can become world leader in all of this. Thank you.
Thank you so much, sir. Like there were a lot of things that I learned throughout this session today, sir. Like if it's term of the kind of like the approach that the doctor should have in terms of like keeping things like overall, if I summarize, then AI can be helpful in creating customized treatment plans, and also like the new term that I learned today, the assistance intelligence that the AI should have. Like the it should have the power to assist the doctors and nurses and the hospital in terms of providing better care to the patients and everything. It was a truly enlightening session for all the viewers who have joined and the people who are going to watch it afterwards as well. And I believe that the approach that you are talking about, if things roll out in that way, if hospitals and doctors proceed and people work more into the like stop worrying about the data part and everything, and we might be able to become the world leader as you are saying. So thank you so much, sir. It was really good. It was really a pleasure to have you on board. So thank you so much.
Aditya, it was very, very nice.